Yeah. So the question is, does looking at one limb and how you perform a movement, it doesn't matter if we're talking about walking or ankle motions, or if we're talking about a functional task. One can ask the question, well, if you go back to the planting image again, if you were to use your better hand and arm, even though it's not the one you would typically use, to reach out to a planter to grasp it in preparation for moving it closer to so you could put some dirt in it, show me how you would do that. Inevitably someone can. It might be a little bit clumsy if it's their non-dominant upper extremity, but they'll be able to do it. So now try to do this with your weaker arm. What's different? They hopefully will be able to tell you. Now there are neurons, nerve cells in our brains that are called mirror neurons. And that's precisely what they're there for. They mimic in parallel what one side of the brain does to the other. And we try to make use of these mirror neurons to optimize the potential for performance. So if a patient starts doing better by watching what they've done with their better arm and then simulating that as best they can and be able to tell the differences between the two, that's making use of this mirror neuron system. And to some extent, that's probably inducing a plasticity in the remaining neural cells that work in a way we haven't thought to do before. Unfortunately, we don't always do that as well as we can as clinicians, where you use the better side as a comparator to the one you're trying to improve. The extent to which patients can begin to recognize the differences become very important. I can recall, actually, in this very room, we were training a patient on a particular project, and I could not help but notice that in trying to do a functional task with the impaired limb, the patient was making the same movements with the better limb. And I asked her, are you aware of the fact that you're making the same movements with your better limb than you are with the actual movement, your impaired limb you're trying to do the task? I said, I think so. I said, why are you doing that? If I try to do it, it gives me a better understanding of what I have to do with a limb that's weaker. And the extent to which we observe those behaviors and reinforce them in the patients who we're trying to retrain, I think has been profoundly underutilized.